Okay. I'm going to call this to order now that I hear the senator is on his way, so we can start with my comments, and he will follow us. He and my colleague Rosa DeLaura are the authors of this bill. As part of the JEC's 2010 agenda, the committee has prioritized evaluating policies that will ensure that the jobs we create and preserve are quality jobs. The report evaluates the effects of expanding paid sick leave and estimates the number of additional workers who will not have to choose between a paycheck and their health. The report shows that the Healthy Families Act would boost job quality and economic security for workers and have the biggest impact on our most vulnerable low-wage workers. The report was requested last year by Senator Dodd, the chairman of the Senate Health Subcommittee on Children and Families. Paid sick leave is a critical piece of job security. Right now, 40% of employers in the private sector do not have it. And among workers in the bottom wage, 65% go without paid sick leave coverage. So 65% of the lowest wage workers do not have paid sick leave. In this time of great economic hardship and uncertainty, the absence of paid sick leave is one more challenge facing workers. Employers have been scaling back sick leave coverage in recent years. In New York City, paid sick leave coverage for near-poor workers declined from 56% in 2007 to 23% in 2009. We absolutely need to reverse that trend. The JEC estimates that 30.3 million additional workers, an increase of 56%, would gain access to paid sick leave as a result of the Healthy Families Act. It would benefit workers hit hardest by the recession and expand access to paid sick leave for many Americans, and in particular, low-wage workers, women, and minorities. Almost half of the workers who would benefit, 14.7 million additional workers, are in the bottom wage area. 13.3 million women would gain coverage. 5.6 million Latinos and 3.9 million African American workers would gain coverage. This legislation would ensure that paid sick leave coverage was available to over 90% of private sector employees. The report underscores the public health impact of the Healthy Families Act. If workers get sick and go to work, they are less productive and can spread contagious disease to their coworkers and customers. Many without paid sick leave are in the occupations where there is significant contact with other people, such as food services and childcare. And I don't think any one of us want to be served food by a sick worker or have our child taken care of by a sick worker. Today, only 2.3 million food service workers have paid sick leave. HFA would expand that number by an additional 6 million food service workers, a total of 259% expansion. Also, just 1.3 million personal care workers, which include child care workers and home health care workers, currently have access to paid sick leave. Under this bill, that number would double to 2.6 million. More and more people are living paycheck to paycheck. The pressure to show up for the paycheck, even when you're sick, has never been greater. No worker should have to choose between a paycheck and her health. And if and when this legislation becomes law, 30 million more workers would be covered under this law. We can do something that is both good for the economy and good public policy.